usually ends around 1:30. Our keynote speaker is Myron Pincombe. Myron is the principal of the Pincombe Group, and the topic will be making sure our community is truly accessible to all residents and visitors. Please see our website for registration. You can contact Kathy Sutton, and it's kathy.sutton@myjaxchamber.com, but you can find all that on the website, and please pre-register. Also on October 22nd, we are hosting a virtual coffee on the coast, and it's going to be cooking with Kalo. I guess some people have gained a few pounds through the COVID, so she's going to teach you some nutritional recipes and should be a lot of fun, but that's only going to last an hour. Absolutely no charge, so please tune in. That starts at 8 a.m. On October 22nd, and please pre-register as well. Now I'd like to introduce the lovely Ashley Sikowski. Thank you.
Well, hello everyone. Thank you so much. So today we have a few very special people that I'd like to introduce to you guys. So Josh Stewart. Josh was born and raised right here in Jacksonville, Florida. He served in the Marine Corps from 2002 to 2007, went to Iraq 2 times for Operation Iraq Freedom. Thank you, Josh, for your service. We really appreciate it. Josh serves on the boards for the Jax Chamber Health Council and Volunteers in Medicine. He also serves as an ambassador and committee chair for Achieving the Dreams Scholarship for the First Coast Hispanic Chamber of Commerce. Josh is the center director for the Jacksonville Town Center and the Winston YMCA Florida Blues Centers. He received his undergrad from the University of Hawaii and is currently pursuing an MBA from FSU. Welcome, Josh.
Thank you so much. Today I wanted just to talk a little bit about the season we're about to approach called Open Enrollment. And it actually kicks off for our seniors on October 15th, and it goes all the way through December 7th. So that gives folks who qualify for Medicare the opportunity to pick a plan, change plans, change carriers, go to original Medicare, buy a prescription drug, get a supplement plan. So it's important to start while we're in this kind of pre-enrollment period to start gathering, information for yourself and your loved ones regarding your doctors, your prescriptions, things that you think are going to be a medical concern in the upcoming year, and have those conversations with your local agent. In addition to that, the open enrollment period for the Affordable Care Act will happen around the corner as well. That starts on November 1st, and it goes all the way through December 15th. And that's the time period where you can find out if you qualify for any of the Affordable Care Act tax credits or subsidies, and see if you can find a plan that supports you and your family's needs. So we were talking about Florida Blue. We've been in the Jacksonville community for 76 years. Our headquarters is actually based here off of Deerwood Campus Parkway, right down the street from Gate on the south side. And we also have a location over in the Riverside area, kind of near where the Winston YMCA is. So we're Florida Blues Blue Cross. Florida Blue is basically Blue Cross and Blue Shield's plan for Florida. And we actually support all 67 counties with the Affordable Care Act, with Medicare plans, and even group plans. So we do small group, mid group, large group. We even have some national accounts for companies that are based out of Jacksonville and have multi-state locations. So we're here to support you, your business, your family with any kind of health insurance needs you need. We are not for profit company, so we're accountable to our members, not to stockholders. So we're driven by our mission, which is to help people and communities achieve better health. So that's a differentiated value that we have over other national carriers. Florida Blue does a lot in the community. You've probably seen us partner with Feeding Northeast Florida lately to make sure we can sum up some food insecurities in our backyard. But we also do a lot with many of the social determinants of health. So currently, Florida Blue is offering a free emotional helpline for anyone, and it's open 24 hours a day, 7 days a week. And you don't even have to have Florida Blue insurance. It's really for anyone. So I'm going to give you that number. It is 833-848-1762. So if you think of any friends or family members that are going through some tough times with COVID and the pandemic, please refer them to this resource. At our Florida Blue Centers, which I oversee, we offer a wide variety of resources. So we have a sales team that can help you find products and services that we offer to help you and your family and your business. But we also have a customer support team where you can get basically any questions about your plan answered. We can help you out with understanding your benefits and understanding the tools and resources at your disposal. And lastly, we have a care program, and the care program is comprised of registered nurses and social workers that can help you out. So the nurses, they really focus on major chronic condition prevention. So like diabetes, heart disease, things like that. They focus on preventing and maintaining those conditions. Our social worker actually focuses on the social determinants of health, and actually where the insurance stops, she will actually pick up the ball and find local community resources, reach out to our extensive nonprofit network, and put you in contact for things that aren't really tied to health insurance. Like, I'm having a hard time with my rent. I'm having a hard time feeding my family. I'm looking for job resources and tools. So we do a lot more than just, sell insurance. We're actually really a mission-driven company, and we want to make sure that we're here to support the community. I think that's added value that you don't get a lot with other insurance carriers. So if you want to reach out to our virtual centers, because we're still working from home until this COVID is kind of packed away, you can give us a call at 904-363-5870. And we're open Monday through Saturday, 8 a.m. to 7 p.m. during the open enrollment season, and 12 to 6 on Sunday. So thank you guys so much for having me. Appreciate it.
Great, Joe. Thank you so much for telling us all of that fun stuff about Florida Blue. And if you would just maybe put the telephone numbers in the comment box, that would be awesome. So for people that might need this. So without further ado, we have got a couple of keynote speakers who I am so thrilled to have today. So Craig Mandeville, a seasoned innovator and entrepreneur, is the founder and fearless leader of Forcura. Craig is joined by Jocelyn Donahue, Vice President, People. With titles like these, you're in for a treat. So Craig founded the company in 2012 after witnessing firsthand how much of an impact digital management of medical records and secure communications could have on improving patient care. Craig's vision is to lead the change in post-acute care towards true interoperability, reducing the redundancy of documentation through the continuum of patient care. Prior to Forcura, Craig was a sales leader for Intuit Enterprise Software Division, MRI Software, and co-founder and vice president of Waste Reduction Consultants, Inc., later acquired by CAS Information Systems. He graduated with a Bachelor of Science in Communication and Business from the University of Texas at Austin. Craig currently serves on the National Association of Healthcare and Hospice Board of Directors and is actively involved in several organizations committed to elevating the growing technology sector of Jacksonville. Jocelyn Donahue enthusiastically oversees the people team at Forcura and has designed and implemented an infrastructure where the development, retention, and recognition of the value of the people behind technology has positioned Forcura as best in class on a local and national level. Jocelyn previously practiced civil defense litigation in Charlotte, North Carolina, where she remains a member of the North Carolina Bar Association. She also served as an adjunct faculty member at the University of North Florida, teaching law courses. Jocelyn graduated with honors from the University of Florida with a Bachelor of Arts and Science in Criminology and Psychology. She earned her Juris Doctorate from the University of North Carolina School of Law. She enjoys Broadway shows, reading cookbooks, and occasionally cooking something from them while exploring Jacksonville with her family. In honor of our awesome guests, I've learned that Craig and his team are all big fans of Elvis. So I'll be sporting my signature Elvis glasses presentation.
Thank you.
Forcura.
Nice.
Love it.
That's awesome. Jocelyn, I don't know about you, but I don't recognize the people that she just described.
I can't tell you the last time I cooked something, Craig.
That was awesome. Thanks for the intro. So we have some slides that we're going to put up. All right, perfect. All right, so we can go to let's just go ahead and go to slide 3. I thought I could tell you guys a little bit about the background of the company, what we're up to now and where we're going. And we wanted to really touch on culture and how COVID has, impacted us and how we've embraced this new reimagination of how you work. Little quick story. I got to Jacksonville. I'm from Texas originally. I started a company there. Ended up moving it to Jacksonville in 1999, and we had a couple partners that were out here that we were making more money. That's why we moved it out here, and it was an incredible ride getting here. And fast forward now. I met my wife, Heather, here in Jacksonville, and I ended up exiting that last company that we started, which was waste reduction. And my wife, at the time, when I met her, she was working for a home health agency here in town. And her whole role was to really own the discharge of a patient that was leaving Mayo Clinic, was her main account. And make sure that they got into a new, care setting, which is mainly home health or hospice. And she'd come home and complain about just the lack of information that makes its way from, the hospital system and back over to the home health agency. She would tell me stories that, she'd be handed a stack of about 150 pages, which is basically the entire history of what's happened to that patient for the last few weeks in the hospital. And she's literally at Mayo Clinic faxing these pages to this home health agency. Half the pages aren't going through. It's a complete nightmare. And if you think about that, getting the information in the right hands at the right time to make really good patient care decisions was definitely is a huge risk. So that was really where the light bulb went off back in 2012, where Forcura was really born. And really the main problem that we're solving is no matter where a patient's going into a different care setting and post-acute, our whole mission is to ensure that we're empowering better patient care and that information makes its way from one care setting to the other in real time. That's been the really the core behind the business since 2012. If we go to the next slide, so a little bit about our tech solution. Anytime a patient leaves the hospital, makes its way into post-acute, it will probably come through our system. And we're using now artificial intelligence to read all the information and really understand where that patient should go. What's the appropriate care setting, and what is the reimbursement strategy for that patient? Can we identify comorbidities that are in that? What's happening into that for that patient, and where should they go and maximizing the care and the reimbursement for that patient? We've also deployed an entire mobile communication solution that allows all of our customers, which are mainly home health, hospice, post-acute providers across the country, allow them to securely communicate and ensure that every decision that they make, they have all the information at their disposal to make the right care decisions. We currently have a little over 429. We have 429 customers as of today, which is awesome. Our headcount is 82, Jocelyn, if that's correct.
82 full-time, 2 part-time.
Okay, yep. And we are growing. We're actually growing faster now than we ever have before in the history of the company, which is absolutely astonishing in this in this time frame that we're through a global pandemic. If we go to the next slide, I do want to let everybody know that this picture was taken about 20 minutes ago. I'm just kidding. No, this was taken definitely about a year ago, but I thought this was we had the slide put together. I'm like, I don't know, it's got COVID spotlight, but it has us all in one big group together with the masks on. All right, next slide here. So I mentioned that we're mainly in home health and hospice within post-acute, but there's a lot of other care settings that exist, like skilled nursing facilities, inpatient rehab facilities, long-term care. There's durable medical equipment, infusion, behavioral health. It's a massive, massive industry. So we have roughly a little over 50% of the entire home health and hospice industry that's utilizing our platform as of today. And you can see it's the dark blue section, and there is a massive amount of expansion that we're currently working on to really expand our product, but also get into these adjacent markets in the post-acute. Go to the next slide. One of the things, just to talk a little bit about, when COVID hit, I remember we actually had a chalet at the Players, and we flew in some customers, and we had a great event, which thankfully started on Wednesday. We had our customers at our chalet Thursday, and they were going back Friday, so we kind of really lucked out with this. And literally, I remember that's when everything just started shutting off. And we went fully remote March 15th. And we've been fully remote since. You'll see a couple people. I'm in our office right now today, but you'll see maybe 2 to 3 people in our office. But for the most part, everyone's fully remote through the end of the year as of today. Our industry, healthcare at home actually exploded, and the technology investments in this industry exploded from March to date, and we see that really accelerating even further. If you think about when this hit, we had clinicians, nurses, right, that were visiting the homes of these patients that were scared to go into the homes. And then if you're a patient, typically elderly patients, that were scared to death of having anyone in their home. And so our technology solution does a lot of live video. So, being able to communicate without necessarily entering a person's home. So the adoption of telehealth has been absolutely massive. We've seen skilled nursing take a pretty big hit. There's a lot of work being done at CMS right now to work on improving a skilled nursing at home payment model, which is very, very interesting. So we're seeing a lot of skipping over the brick and mortar, patients leaving hospitals sooner than they ever have before, getting them in their home. So one thing that, in our industry, in this home health and hospice, it's kind of the one that's always left behind. A lot of the acute care and ambulatory spaces, the hospital systems are really all typically in the limelight. And I think this industry has really taken on a big appreciation for healthcare at home, which is where we are and where we'll be for quite some time. You get the next slide. So yeah, touched on this a little bit, but the investment in technology, analytics, automating, interoperability has been somewhat of a misnomer in post-acute, and we're working to solve that. So there's a lot of investments happening. There's a ton of private equity groups that are getting into this area. It is a massive opportunity. Healthcare is certainly shifting into this area, and we couldn't be more excited about where we are and where we're headed into the future. Get to the next slide. Okay, so we go to if you can advance it one more. Okay, perfect. So I bootstrapped this business, and early on, when I started it, I went to the first conference, and I remember I picked up a couple customers at the show, and came back to Jacksonville, in 2012, and was celebrating, like, oh yeah, I think we figured it out, we got it. And what I was showing at that show was a prototype. It wasn't even actually finished technology platform. So the other half of the ride home, I'm crying because I've got to finish this product and get it deployed and implemented. And so it was funny you guys mentioned Myron Pincombe, who will be your next keynote. He's a good friend of mine, and he was one of the first investors in Forcura. Myron, and then also Chris Haley, who was at Black Diamond, which is now Advent SS&C, invested in Forcura very early on, took a big risk in doing that. But since then, since we started, we were profitable in 13 months after taking on that initial small round of investment. And we bootstrapped this company, and we had been managing it to a 5 to 10% EBITDA margin every month. And we've been really reinvesting our profits back into this business to date. Really before July 14th we had. And we had gotten to the point, and I sat down with our leadership team, Jocelyn and the others, said, look, we've got this massive opportunity in front of us, and we need to bring on a partner to accelerate the growth of this organization and really align to the vision of this company, which is to become the standardized communication platform for the entire post-acute healthcare market. So you saw on that prior slide how much opportunity is in front of us, and we just could not do it on our own, and me being a restrictor plate. So we went out and we found an amazing private equity partner, Excel KKR. They're based in Silicon Valley. They're probably one of the best, most prominent private equity groups in the industry, really strictly focusing on software as a service, technology, and vertical software companies, very similar to Forcura. So we partnered with Excel KKR on July 14th, and they've been an amazing partner, and we're building massive plans to grow this organization and take it to the next level. If you go to that next slide. Coming from Austin, Texas, when I moved here in 1999, it was a very different culture in Jacksonville. I moved out to the beach, and for those of you who've been here as long as I have, what a transformation. I literally have fallen in love with the city, and we're doing so much to really make this an innovation hub of the Southeast. It's one of my personal goals is for those that come here to see us as a technology innovation hub. We're not quite there yet, but a lot is in works to get us there. So a lot of hard work, not only what we're doing, but the city, the chamber, and a lot of vehicles and resources in the city of Jacksonville. We partnered with the city and the state. We're bringing on 115 new positions. We actually, that was a forecast before we partnered with Excel KKR, and I can tell you we'll probably double that, which is awesome. We'll more than likely add a few hundred positions over the next few years. So we're excited. We focus a lot on an internship program where we bring in really smart minds from local educational institutions like UNF and JU, University of Florida and Florida State. We launched a podcast called Innovate Jax. So if you go to Spotify or Apple Music, download that podcast. We just launched our 15th podcast, and what this is really connecting innovators and leaders across the city of Jacksonville, telling their story and really connecting those people with one another. So that we can drive and move the city of Jacksonville forward to really align with being, this tech innovation hub, which is a big vision of mine. And then we give back. We donate our time, a tremendous amount of time. We have a culture team that I know Jocelyn will probably speak to. That all we think about is how we can do better for our team members internally, but how can we give back to Jacksonville and others that are connected to our core values in the organization. And we've made a commitment to donate 5% of our profits every year to these causes. So we certainly have seen a lot of success, and it's very fulfilling to make that happen. Go to the next slide. I think, Jocelyn, if I'm right, I think you have a video, a culture video that'll be played now. Okay, here we go.
Absolutely.
Uh-oh.
Craig, you're gonna have to ad-lib through the whole thing.
You guys get the volume to work? If not, it's no big deal. We can shoot out the link. This video is actually on our website, so we can copy and paste this link into the notes section of this meeting. So why don't we go to the next slide? And I'll tell you, Jocelyn, you heard her background. She's absolutely amazing. When she came on, I think she had four roles in one, and one of them was HR, but it was very thin at the time. And her passion is all about our people, finding the best talent, cultivating that talent, and really driving the absolute best decisions, for our employees who are the best place to work. So, Jocelyn, I'll hand this to you.
Yeah, when we were preparing, thank you, Craig, and thank you so much for having us today. This is one of our most favorite topics, is to talk about culture. It's so important to the organization. It's one of the company's goals since the inception of the organization. I remember when I was interviewing with Forcura for a role, it was emphasized as strongly 4 years ago when it was about 20 people as it is now with every new hire. I think culture is important to talk about too, because candidates, the quality candidates that you're looking for, they're asking about culture. And so you can't just say, oh yeah, we have a great culture. We met with a candidate literally this week for our technology team, and he asked such a great question. This is a high caliber, talented individual who's considering Forcura, and we're considering this individual. And the question he asked during the interview to the 3 panelists from Forcura was, culture is important to me as a professional, and you guys say you have a great culture. I'd like to hear examples of what has been meaningful for each of you. And it was such a fun answer to give him, because we could talk, extemporaneously about so many things that were individually important to each one of us. So can we go to the next slide? Like I said, there's so many ways that we can talk about culture. I want to make sure that and if you have questions, please put them in the chat box. We're happy to answer. Transparency is one of our core values as an organization. So anything that we can share that we have found to be working for us in keeping employees happy and satisfied and retained, we're happy to share with you as well. So let's start with the first one, our hiring philosophy. I tell our hiring managers routinely, every time we're talking about a new position, that if a candidate is not a hard yes, it's an absolute no. So it's, some individuals, recruiters can be frustrated with us because we have extremely high standards with respect to the level of talent that we're looking to bring in. We're looking for not just experience and technical skills match, but we're looking for someone who's going to add to our culture. We feel passionate about our culture, guided by 5 core values of transparency, passionate, bold, innovative, and the last one is fun. And those qualities are used to vet talent, because we want to bring in individuals who are going to add to each of those categories in their own unique way. And so we take hiring extremely seriously. We try to move people very quickly through the process. We want to be respectful of every candidate who does apply at Forcura, make sure they get through the process, they hear back from us. I tell everyone, you're never going to not get an answer from us. If you apply for a position at Forcura, you'll have an answer from us. We try to move people quickly through the process, and we try and get as much input as we can from members of the team in vetting excellent talent. We have added 14 people to the company since going 100% remote, and that has been a whole breadth of new challenges for the organization in terms of onboarding. And so we've taken, again, that core value of innovation and said, okay, how do we onboard this new hire who is in Chicago or Seattle? We're talking new time zones. We're talking about equipment challenges. How are we going to have them feel part of the culture from before day one? And how do we get them connected? So we have put our heads together, working with the culture team, working with our training team and our onboarding team, to be able to have them feel connected. how. Their equipment is set up well in advance and tailored specifically to them. They receive a lovely welcome to Forcura gift basket of all sorts of fun swag so that they feel connected to the community, even though they're not here in person. They're set up with what we call a Forcura friend early on, someone who's not on their team, who we feel like from their background we can compare with our internal team and find someone for them to connect with, not necessarily in a mentorship capacity or a supervisor capacity, but someone who they can feel like, okay, on day one, at least if I have a question, I can reach out to this person. I think one of the themes we've had through onboarding through this time has been over communication, and that theme has been woven through the company culture. Craig and I talk about it all the time. There's no such thing as over communicating during this time. In terms of keeping in touch with our team members, as Craig mentioned, we have 82 full-time employees as well as 2 interns from local universities right now. And we're bringing on between 5 and 6 next month. And how do you maintain that level of connectivity that we pride ourselves when we're in the office? We still do daily huddles within the team, and we do everything via video. We've all gotten quasi good at talking at these cameras. And when this all first started back in March, nobody wanted to be on camera because, nobody wants to be on camera. We've all gotten very used to that. And I think that adds another layer of connectivity. We've done handwritten notes. We've done check-ins with the managers, still meet with every member on their team once a week. We do all company huddles where everybody's camera is on. Every Friday, we do a half-hour huddle in the morning just to level set what's going on, successes of the week, what's been keeping everybody busy. Another way of connectivity is we've done our people team, which is a fancy word for human resources, which we feel is more aligned with our culture. Our people team did outreach to every single employee twice since we've gone remote via video phone calls for the sole purpose of checking in and getting feedback. What do you need? What's going on? Do you feel supported? How are you feeling about the office potentially reopening? Safety and security and flexibility have been our mantras with respect to the office and the reopening of the office, and hearing back feedback, compiling all of that and sharing with the leadership team. That deliberate communication to me has been paramount, not just with onboarding, but with the team. Craig, would you agree? Oh
yeah, it's been, yeah, and I think what you said is over communicate. And another word that comes to mind is reimagining.
Yes.
When March 15th came, and many of y'all were probably thinking the same thing. Well, maybe this is going to be over in another month or maybe 2 months, right? Well, here we are. It's October 1st, and so it's definitely been a lot longer than I anticipated. Right on the onset of this. So we've actually been more productive, and we've optimized so much. Throughout the organization. An example would be, our relationship managers who really own the relationship between us and the customer, and just making sure that they're up to speed of where they're going and where we're going, and just, making sure that they're a happy, longstanding customer. And, typically I would go on these, and I'd have to coordinate, with the relationship manager, and, coordinate the flight, and where are we staying, and, are we doing an Uber? Like, what's the deal? And that was the same also with engineering. Because we're big on getting our engineers out and meeting with our customers so they can see what they've built and actually get the feedback face to face. It's incredibly helpful, and it makes us pivot and make improvements to the system. But now you don't have to do that. It's as easy as what you're seeing right now. I could join a review with a relationship manager, an engineer can. And it's become more, I would say, the better communication. We've actually have understanding more about our customers now than we ever did before. So that's just one example. And so we've spent a lot of time of reimagining how can we approach this in a way, thinking outside the box, to use this as an opportunity to look at the ways of how are we conducting business. How can we improve and optimize, processes that align to the core values of the company.
Again, back to those core values, they truly, I tell every candidate I speak with, I said, they're not just on the wall. They are on the wall. We have a beautiful graphic that one of our team members designed. So they are on the wall, so you can walk by and see them when we're back in the office, but they truly are part of the DNA and the fabric of every candidate we look at. Every performance evaluation we do, we run it through those core values to see how they're aligned. Craig mentioned earlier about the culture team, and that is such a key part of the success of maintaining the culture at Forcura. It's grown since I've joined the organization. The budget for the culture team has also grown, which has been lovely as well. They are just a breeding ground for excellent ideas to maintain engagement. And I have been so overly impressed with the organic ideas they have come up with to maintain that level of high spirits and morale. You know, taking a high level look of what some of the things that they've done, they meet every other week and just come up with these amazing ideas and pitch them and brainstorm them and advocate for them and champion for them. And Craig and the leadership team are like, yes, do that, make it bigger, just go with it. So taking a high level of it, what is the purpose behind it? Specifically during these remote times, I find it's all about creating moments and understanding that you're never gonna have 100% participation at anything that you do. So how can you create experiences, moments, potential areas of engagement in a fun manner for individuals that's diverse enough that you're going to catch somebody at some point. Some random examples off the top of my head. Every Monday we do a Mindfulness Monday exercise. And I can promise you there are members of Forcura who will never take 10 minutes to quiet their minds and be still and listen through a guided meditation. We have a core group of people that do love to do it. That same person who will never participate in a mindful meditation on Monday might be the first person for the Who Has the Cutest Dog contest that pops up on a Tuesday. We have done virtual cooking classes. We've done virtual yoga classes. We've done virtual 5Ks. We have an opportunity to have a personal coach to walk you through if you're going through something through a hard time, or if you have a weight loss challenge or something that's in front of you. We've been able to pair up with a community resource to provide coaching during this time. We've done scavenger hunts. We've done virtual cooking classes. We've done surprise gifts. All of a sudden, everybody on a random Wednesday gets a knock at the door and there's some new Forcura swag for them they weren't anticipating. Just a way to maintain that level of surprise and engagement and showing that the company truly does care about you as an individual and you as a person, and maintain that level of connectivity, because that is truly what's missing. When you come to Forcura, back when you could, and when you will be able to again, you feel that energy walking through. You feel just a heightened sense of people are here because they want to be here. People are working really, really hard, and people generally enjoy the people that they're working with. And our candidates who come through really feel that. And so that's missing virtually. And so we do our best to try and maintain that, because we know we will be back in person again. And so how do we maintain that connectivity, that relationship building, not just for new members, but for team members across the board?
Yeah, we one of them that was one of my favorites. We had we shipped out a cocktail mixer that with all the ingredients, and we had a bartender that logged in just as we are here, and took the time, and we made I think it was a watermelon
Margarita.
Well, yes, watermelon margarita. It was delicious.
Mm-hmm.
And so I would like to invite everyone that's on this call to come and see our new office. We're in an office it feels like we just moved in here. We've outgrown it, and we're taking down I think about 30,000 square feet. And for those of you who've been to this office, get ready. Our next office is going to blow it away. And we've got some exciting things that are very, very different that you will not see in any other office in Jacksonville, Florida. So when we are open, we'll let Ashley know, and we'll extend an invitation to have you come and take a visit when it's safe and everyone's comfortable doing so.
That's another example of what Craig just did, which we didn't plan. That's another example of how we're continuing to build anticipation, excitement, and positivity, looking towards the future. The only people who know anything about this new office is Craig and a very small group of individuals, myself not included. And so he teases these things that I don't even know what he's referring to, but I just know it's going to be
You're
amazing.
gonna love it.
That's what I hear. That's what I hear. It's going to be amazing. But that's something that we continue to emphasize, that, you know, these are dark days for many people. And that's one thing that I've connected with, you know, everybody. Like I said, I was part of those phone calls and outreach, and everybody is going through something. I mean, we've had births within Forcura. We've had, you know, passings of family members within Forcura. We've had, you know, individuals who've had, you know, big events in their life and really small events. There's something going on with everybody. And for some people, these have been some dark times. And so the idea that we have something to look forward to, that we can build excitement for, that we can remind them that this is a moment, and we're going to get through this moment, and there's, you know, brighter skies ahead, and let's keep working hard, and let's keep supporting each other. And then we have this amazing office with apparently all these amazing surprises to look forward to. It's an easy way to build those sort of anticipation and positivity as well. I want to be conscious of the time, Craig. I see it's 12:41 according to my clock. I think we had if there's any questions in the chat that we can answer.
Yeah, I think Courtney said she was going to play the video.
Oh, good.
But if not, if it doesn't work, we'll open it up for questions. Oh, there we go.
Maybe.
Forcura is an amazing place to work. I think, you know, we've been very deliberate and thoughtful around hiring the right people, A-plus players that are aligned with our vision and really the overall culture of the company.
So I think Forcura is different than other healthcare companies in the sense that we have a lot of fun here. So, you know, it's definitely a work hard, play hard mentality. We're passionate about what we do. We're passionate about our clients. But at the end of the day, we do always find a way to sprinkle a little bit of fun.
The company really has made an effort to make sure that we can, you know, take care of our business outside of the office first. Craig has made it known that if you don't have everything right at home and a healthy, happy life, then it's going to be hard to come in and perform well at the office.
Being here has really helped me look at things from a different perspective and to just kind of think about, you know, do I want to work for a company who's doing something good out there? And definitely yes.
The type of person, in my opinion, that thrives here at Forcura is someone that's always looking for a challenge, someone that's looking to get into something new, someone that loves technology, someone that's always willing to question why.
You know, at this point in my career, I feel, you know, fulfilled. I feel fulfilled knowing that, you know, what my work is doing and who it's helping.
My favorite part about working at Forcura is how close all of us are. Just the nature of working with our clients. We have to be very collaborative, work together.
At the end of the day, we're not the ones who are going into the homes or holding someone's hand and trying to make them feel better, but we're giving them the tools that are going to allow them to give more of themselves to their patients.
Awesome.
I miss those faces so much.
I know.
I'm tearing up a little bit. It's so
I almost started to tear up a little bit.
I did too.
I'm, like, well, I'm looking around. There's no one here.
Oh man. Yeah.
Well, yeah. Let me see. I'm trying to read through this if there's any questions, but maybe I'll turn it over back to Josh, Ashley, and I know that you guys wanted to do a breakout session here, and just to stick to the time frame.
We've got a couple of minutes. If anyone has a question they want to put in the chat box, for the time being, I've got one. Craig, this is very interesting. It's, you know, it's always interesting to me to find out how little health systems communicate with each other. Do you see down the road a day when hospitals are sharing all the patient information readily available, so that, you know, it really does increase that continuity of care?
Yeah, so there's a big initiative going on right now called Care Quality and Commonwealth, and basically it's a big repository, if you think of a well, of all of the patient information from the hospital system. So when you go there, usually these hospital systems will use Epic or Cerner as their EHR, and there's a lot of other ones, but those are the two leaders. And then both of them and the others have all signed up to share that information into this Care Quality Commonwealth. And so this is fairly new. But the problem is the pipes and the interoperability to exchange this information. And this is a big area that we're focusing on and investing in heavily in post-acute to transport real-time patient information across the continuum of care or that care journey. A patient may go to the hospital, they may be in a skilled nursing facility, they may go to home health after that, hospice or palliative care. So in transporting that information, like you said, Josh, it's imperative. It's a big issue across healthcare, from the acute side where the hospital systems play, and then one layer down where we are as a post-acute market. It's even worse. So I do believe that is going to happen. The amount of investment in technology that's happening today in our area, I've never seen this accelerate at the pace that it's accelerating right now in the middle of a global pandemic. So I think a lot of, there's a lot of eyes on this and a lot of action that's happening right now. So great question.
That's great. It looks like we have a question from Eric Ross. Has Forcura done any work in the pediatric home health sector? And a follow-up question, do you currently work with any of the large local home health companies here in Jacksonville?
Great question. I believe we have a couple pediatric home health companies across the country that we work with. That's kind of a smaller niche area in home health. We definitely have a couple of the larger players that are customers. We work with a lot of large national home health companies. Amedisys, who has a presence here in Jacksonville. They have, I think, 550 care center offices across the country. Brookdale, which is a big name in the long-term care space. They also have a home health presence here in Jacksonville. Another startup company here in Jacksonville is Concierge. And they're a growing startup company here in Jacksonville. Took on some private equity investment, and they are really taking off. And they're a wonderful customer of ours as well. So yeah, great question. I can go on and on, but we definitely do. We have a lot of customers here in Jacksonville, but we're in every state across the U.S. as well.
Craig, I feel bad I unmuted myself. I'm the same. I could ask you 20 questions about home health care. I'm kind of obsessed with that world. So
yeah, no problem.
All right.
All right. Well, I just wanted to say thank you, Craig and Jocelyn. You guys are incredible. I personally cannot wait to step foot into this new space that you have. Yeah, I'm gonna put my glasses back on and we're gonna transform right over there. So thank you guys for coming. Thanks for sharing your culture with us and your business and also in the community. Let's not negate the fact that you are giving back 5% of what you're making. And that is huge for Jacksonville. So thank you for that.
No problem. We'd love to do it.
Yep. And I will turn it over to Jason or Josh or Jim or someone.
Yeah, thanks, Ashley. So thanks to Craig and the whole Forcura team. We're going to break out now into networking. So you'll automatically be assigned a separate breakout session. Spend a few minutes, introduce yourself, introduce your company, and just be cognizant of the time. We'll automatically be brought back to the main meeting room, so you'll get a pop-up that you're about to do that. So just, have fun, introduce yourself, and network in this new virtual world.
I feel like I'm ready for a roller coaster to take off or something.
I know, right?
There we go.